It's a new layer of concern for children who contract COVID-19. The study found that children with COVID-19 were considerably more likely to get a new diabetes diagnosis within 30 days after infection than those who have not had COVID. Dr. Reena Mehta joins us now to talk about these findings. And Dr. Mehta, we want to, preface our discussion with this is a brand new study, and there are still so many more questions that need to be answered.
Absolutely. So this was a study just published last week by the CDC, and this is the first pediatric study looking at this risk of diabetes in kids who have gotten COVID-19 infection. So what past studies have shown is that there is a risk between adults who have gotten COVID and an increased risk of diabetes. So this is the first one looking at children, and what they found was they looked at two large healthcare databases, and they went back in time and researched between the months of March 2020 and June 2021 and said, okay, these kids who have gotten COVID, what comorbidities came from that? And what they found was that there was over a 30% increased risk of diabetes in children who had COVID-19 infection.
And Dr. Mehta, right now, the scientists behind this study they've made the connection, but they haven't really figured out the why just yet, correct? As far as children are concerned.
Exactly. So this is something where it's an association and a link. Now more data needs to be looked at, more clinical trials need to be rolled out as to try to figure out the mechanism. There are some theories as to why this might be happening. One thought is that COVID-19 may actually attack certain target organs, one being the pancreas. And if the pancreas is not functioning properly, that does increase the risk of diabetes. Again, this is theories, nothing proven yet, but at least we know this association exists. So next steps are to figure out why this is happening and how to prevent it.
And Dr. Mehta, I didn't mean to cut you off there, but I was going to say, I know that a similar study was done with adults, adults who had COVID-19 and who now have diabetes. And you were telling me that they've made that connection, but they're in the process of figuring out the why as far as adults and COVID and the diabetes connection is concerned, right?
Exactly. And there's also some theories about BMI, body mass index. There's been studies that show that patients who have a high BMI who get COVID typically tend to do worse. Those are often patients with diabetes. And so there may be a link between an increased risk of diabetes and COVID in those who have a high BMI. Again, thoughts, theories, lots of clinical data that needs to still be proven.
But Dr. Mehta, I guess the one thing that this is telling us is that COVID, the vaccine, no matter what variant, is still the long-term impacts are still all over the place and unknown. And comparing this virus to other childhood viruses, RSV, flu, have we seen any kind of connections like that before between a virus and a long-term health issue such as diabetes in kids or even in adults?
That's a great question, and the answer is no. So other typical pediatric or adult respiratory viruses such as flu, such as RSV, such as rhinovirus, have not been proven to cause an increased risk of diabetes. So COVID, as we have seen time and time again, is unique in many of its aspects. This is another way which it may be presenting itself that makes it unique. And so I think the key in this situation is prevention, prevention, prevention. If you can prevent getting COVID in your pediatric population, maybe you won't see some of these long-term sequelae. Now, what we don't know about the diabetes is whether this is a transient situation or whether it becomes a chronic problem. Mm-hmm. You know, they looked back at these pediatric patients for only about 4.5 months. So, you know, it's unknown too whether this becomes something for their long term or not. But what we do know is we don't want kids getting diabetes, and so if you can prevent them from getting COVID, maybe that will help.
All right, Dr. Mehta, some really interesting insight and information happening there. And of course, we'll continue to follow the situation as more details on this study continue, but we appreciate your time this morning.
Thank you so much for having me.